Only a quarter of patients have adequate skills to understand their discharge instructions when they leave the hospital. It's unproductive when patients don't understand their health condition, options, or recovery plan. They won't be able to make informed decisions about their care or accurately follow their treatment. This would only result in more health consequences. To prevent this, hospital staff must effectively educate their clients. This gives patients more control over their health in each part of the hospital experience. It helps them make the best decisions for themselves. Hi everyone, I'm Matt from eTactics, and today I'm going to explain 3 important reasons for patient education in hospitals. Before we get started though, make sure you subscribe to our YouTube channel by clicking the button below. While you're down there, hit that alert bell icon next to it as well, so when we post new helpful content, you get notified. One of the most important reasons for patient education in hospitals is so people can make informed health decisions. Almost half of the US adult population lacks health literacy. This makes it difficult for them to understand choices about their care. Informed consent is when doctors communicate all of the risks, benefits, and alternatives of a health decision. When people have different options for treating their condition, education is necessary to guide them to their choice. It's helpful for medical professionals to give their recommendations, and patients may appreciate this. But it's also important not to influence them by withholding necessary details that could help them decide. Of course, there's a fine line for when it becomes an overload of information. You don't want to overwhelm the patient with so many complex terms, since it could decrease their health literacy. This is why the American Medical Association recommends a 6th grade reading level for all information given to patients. When you educate them appropriately, they have all of the knowledge they need to make their choice. The next important reason for education is that it discourages discharge against medical advice, or AMA. Discharge AMA is when a patient leaves the hospital before the physician recommends it. This causes negative health consequences. The person is at risk of an inadequately treated condition, and there's a higher chance for hospital readmission. These readmissions can cost up to $20 billion annually. Patients need to understand that leaving AMA is a major cause of their health concerns. By educating them on what it means if they didn't receive complete treatment, you encourage them to stay. Medical staff must determine the patient's capacity to make the decision to leave. Lacking informed consent suggests the need for more knowledge about the condition and how this choice could negatively impact them. Finally, patient education in hospitals makes it easier for people to follow their treatment. The impact of poor medical compliance is growing worldwide, which leads to disease complications, hospital readmissions, and increasing healthcare costs. If patients don't understand their discharge instructions, they likely won't adhere to their recovery and medication plans. But when they get adequate education within the hospital setting, it makes it easier to follow their treatment plan once they're actually home. When patients don't have proper education in the hospital, it leads to negative healthcare consequences. It makes it harder for them to make their own health choices, or they could decide that they want to leave before the doctor recommends it. Patients also won't recover if they don't know how to follow their treatment plan. Ending up back in the hospital for these reasons is frustrating for the patient and costly for the healthcare industry as a whole. But giving patients all the necessary information about their health and recovery will make them more likely to have positive outcomes. If you'd like to learn more about patient education in the hospital setting, reach out to eTactics. And you already made this far into the video, so you might as well like it, share it, and comment below. What are you waiting for? Subscribe to our YouTube channel.